Ladies, did you know that black women in the US are dying at a rate nearly 3 times higher than that of white women when they're giving birth? Scary times and scary numbers. Childbirth should be a very happy occasion for black women, but it's not right now in this country. And that's why we have Black Maternal Health Week. And that is also why we here at Essence have brought experts to talk to us about ways that we can improve our birthing experience and have one that we want and have healthy, happy children. So I've invited Miss Nurse Queen here. She's a wonderful DMV-based certified nurse midwife, and she's an entrepreneur. Thank you for coming. How are you?
I'm doing good. Thank you so much for having me.
I love it. I love it. Can you tell us why Black Maternal Health Week, first and foremost, is so important, knowing everything that's going on and everything that black women are dealing with when they try to give birth?
I think that Black maternal health in general is very important because Black women deserve beautiful birth stories. Oftentimes, women are dying, and they're dying because they're not being heard, because they're not being advocated for. So I know that Black maternal health, it takes birth workers to really come into the picture and change that narrative of what the birth stories look like.
Yeah.
So Black women and Black families can live on.
Yes. And first and foremost, how did you come to realize that being a midwife was your calling?
Yeah, of course. When I was younger, I wanted to be an OBGYN. I wanted to be a doctor. So I went the route. My mom is Jamaican, so I had a couple choices, nurse, doctor, lawyer. So I went into nursing, and then I got into labor and delivery. I loved it. And I transitioned to get my master's in nursing, which then led me to become a certified nurse midwife. So I have my master's in nursing as a certified nurse midwife. But I love all things birth. I love all things women's health, infant health, and also I love Black women. So being a part of their birthing experience and pregnancy is very important to me.
I love that. And can you kind of speak to what you do in the day-to-day as a midwife, like what you do for your patients and what people can expect when they have a nurse midwife like you?
Yeah, so there are so many misconceptions out there about what a midwife does. But me, I am a hospital-based midwife. So I work in the hospital, and my day-to-day is basically coming into either inductions where I'm managing labor, I'm delivering babies, I'm repairing vaginas after the delivery, and I'm doing postpartum rounds. But my provider aspect is coming into the hospital and making sure that the pregnancy goes exactly how the patient wants it to.
Yeah.
Letting the patient know that they are the author of their story and that they can advocate for themselves, and I'm with them along the way.
Love that. And what's one of the biggest misconceptions or confusions when it comes to midwifery?
There are so many misconceptions, honestly. But the biggest misconception is that a midwife and a doula is the same thing. So let me clear that up right now.
Please.
Yeah, I'm gonna clear it up. Midwives and doulas, they are both needed providers for births, but midwives are medical providers. So we are the providers that deliver the baby. So when the baby comes out, we're delivering. When the vagina needs to be repaired, we're the one repairing. And doulas, they're needed as well, but they're not providers in the aspect of physical, but more so emotional and advocacy. So I like to frame them as like the other baby daddy, basically. And they advocate for the patient. They're educated to help the mom during their labor, their pregnancy, prenatal, postpartum. So both are needed, but midwives deliver babies just like an OBGYN does, and doulas help from an emotional standpoint.
Yes. And what do you love most about the work that you do?
I love being able to be a part of the most vulnerable, exciting part of a woman's life. You don't get many moments like that as a woman. So being a part of that with women, especially Black women, when oftentimes it's scary, it means a lot to me because I'm able to advocate for them when they're unable to advocate for themselves.
Nice. I love that. I love that. So Nurse Queen, she's here to give us not just this information, but she's also going to break down some of the myths and things that you need to know and consider if you're getting ready to have a child and you'd like to have a certain birth team that is more supportive and understanding and helpful and make sure that you're safe and have the best delivery possible. So we're going to give her the floor and allow her to share 5 things that you should know when you're considering a midwife.
Okay, so hi everyone, my name is My Queen Dickens. I am a certified nurse midwife, and today I'm going to give you 5 things that you should know about midwifery care. Number 1, the biggest misconception about midwifery care is that a midwife and a doula is the same thing. Midwives, they are providers that deliver babies, and doulas are there from an emotional standpoint. Both are needed throughout your birthing experience. The second misconception is that midwives are only able to deliver at home. We actually can deliver in a variety of settings. So we're talking home birth, birthing center, and hospital. So knowing that you can be safe in any setting that you choose for your birth. You do not have to be scared of the hospital, ladies. advocacy is there for you. You can have a doula in the hospital. You can have a midwife. You can have your desired birthing team. Number 3, most people think that midwives only are there during pregnancy and postpartum, but midwives can actually take care of you your entire lifespan. As a woman, a midwife can take care of a newborn to 28 days and also your GYN and women's health. So we're talking prenatal, postpartum, birth, and also perimenopausal and menopausal. Number 4, when we're talking about a birth, you should definitely have a plan. Now, I don't really like to resonate with birth plans, but I do think you need to have some type of birth guide. Your birth, your labor, it may not go as planned, but I want you to be able to advocate for yourself. I want you to have some things in place. So having a birth guide that's going to guide you through this experience is going to be very important. So you know exactly how you're going to navigate your birth, your labor, your postpartum. And there are many different resources out there for you to use. There's an amazing company called Motherly Touch that actually has postpartum bags and also birth guides for women to help them plan their birthing experience. And number 5, lastly, you are the author of your birthing story. You are in control. You are able to advocate for yourself. You are capable of creating your dream birth team. Whether that's a midwife, doula, lactation consultant, you are capable of doing that in any setting.
Weren't those the best recommendations? Thank you so much, Queen, for sharing your knowledge with our lovely readers, our lovely watchers, everybody, all the SEs. We appreciate it so much because, as you know, we want to have healthy and happy pregnancies, and it's a very scary time for Black women to do so. So thank you for all that you do. Thank you for championing us, taking care of us, sewing up vaginas. We appreciate you. We appreciate you. We appreciate all the mothers-to-be, all the moms, all of the birth workers. We really appreciate it. So we wish you all a happy and healthy pregnancy, and we thank you for watching. Thank you so much.
Happy Black Maternal Health Week.
Happy Black Maternal Health Week.